Okay, this week the ABC is focusing on the mental health of Australians. It's been tough lately, we don't have to tell you that. A terrible drought, bushfires, and then came the lockdowns that are still continuing in some parts of the country.
Well, experts say we need to be prioritising our mental wellbeing. Joining us now from Brisbane is the National Mental Health Commission CEO, Christine Morgan. Good morning, Christine. Welcome to Breakfast.
Good morning, Lisa.
If you had to give the nation a mental health report card this morning, what would you give us?
Look, I don't actually really want to score that one, Lisa, to be honest. I think rather I'd like to say this is a time for us to really reinforce that we are in this together. I was just listening there to somebody saying how they felt as though they were being singled out. What a horrible burden to put on top of everything else. So I guess really my call out this week, Lisa, as we go and focus on mental health is, let's remember we are still all in this together, all of us going through different experiences, but we've got to help each other.
What can people specifically do this week with this ABC initiative?
Look, I think there's a few things. I think the most important thing is to keep holding on to the fact that our mental health is just part of who we are as human beings, and we actually have to take care of it. So I'd call on anybody who's being affected by this pandemic crisis, whether they are in lockdown, and my heart goes out to all of those 3,000 residents in the lockdown, or otherwise, that look after your mental health. It's going to be impacted. There are things that we can do to help it. And most importantly, Lisa, the more we look after it, the more resilient we can be to try and get through this really challenging time.
Certainly, that situation in Melbourne is the focus of our reporting this morning. I mean, what does it do to people to have such a heavy police presence around buildings like that? How does that affect people's mental health?
Oh, look, of course it does, and particularly for people who might feel a sense of apprehension about authority, etc. Of course it's going to affect them. Look, unfortunately, those environmental factors we are less able to control. The authorities are making decisions which in the best interest they truly believe of those they are looking to protect. So what we need to do from a mental health perspective is recognise that it's going to cause anxiety, it's going to cause concern, it's going to cause fear. And I just reach out to those people and say, look, there are services that can help. There are support lines in particular that you can contact where trained people will help you find strategies to cope. Because, Lisa, a lot of this, when it comes to our mental health and wellbeing, is having the professional help to find the strategies which will enable us to get through.
And you're an advisor to the Prime Minister, the National Suicide Prevention Advisor. What have you been seeing? What have you been telling the Prime Minister? What are you most worried about as we go into what could possibly be rolling containments in places right around Australia?
Very good questions, Lisa. Look, firstly, I think that one of the things that I've been really emphasising is that there is no abating of the mental health impact on people. If anything, the longer this goes, the more it is cumulative and it's increasing. So we need to be aware of that. But we also need to be aware of something quite interesting, which is that at the beginning of this pandemic, we literally were all in it together. All of us were really frightened. We all went into our homes or our closed environments. None of us knew what the future held. We had a sense of we were in that together. What's now happening is we're easing restrictions around the country, and unfortunately some areas are having to go back into restriction, as we're seeing in Melbourne this morning, is that the diversity of what we're experiencing is spreading. So I think we need to understand that the anxieties are really complex. We are really seeing the economic bite, and we know that that's causing significant concern for anyone who's affected, and that is most Australians. And as we said at the beginning of all of this, that many Australians came into this already off the back of drought and bushfires, etc. So I think the most significant message is we cannot and will not take our foot off the pedal, that we must be there to call it out, to say our mental health and wellbeing is important, to ensure we provide services for people, and when we see mental health issues escalating, that we have the services that can reach in and support people and give them the help they need.
Christine Morgan, great to talk to you this morning. Thank you.
Thank you.
It's a discussion we'll be having all week. If you or someone you know is experiencing distress, please contact Lifeline or the Kids Helpline. And this week the ABC is sharing tips, strategies and information supporting your mental health and wellbeing. So go to our website and check out what's there. But also it's critical for a discussion like this that it's not the ABC talking to you. You need to talk back. And thanks for your comments this morning. Ian says, as a parent of 2 kids with autism and a spouse struggling with chronic depression, I'm overwhelmed by pressures of mental health at home. And in this current pandemic, keeping calm with constant reassurance of good times ahead is part of our survival.
The helplines have had massive spikes in calls. Do call them. They've got the staff there to help you, so don't let that put you off. But it just gives you an indication of how many people are reaching out, needing help at the moment.